All right, this review is about dental implantology, and it's a review for those of you taking national boards examinations. Okay. All right. So, question number one: what is the allowable bone loss the first year of implant placement? Okay. So you're supposed to know that the first year that you place an implant, okay, the patient is going to lose some bone, a certain amount of bone the first year, and then certain amount of bone this in the subsequent years. Okay, so how much bone loss in the first year after implant placement? Is it A, 1 to 1.5 millimeters, or B, 2 to 3 millimeters, C, 3 to 4 millimeters, or D, 5 to 6 millimeters? Okay, so our answer is A. In the first year after during the first year after the first year of implant placement, you realize that the patient has lost about 1 to 1.5 millimeters. So you're supposed to know this, and you're supposed to tell the patient. However, if the patient is a very good patient, maintains good oral hygiene, this bone loss is going to be to stabilize after that. Okay, in the subsequent years. All right. So question number two: how do you classify an open tray impression? Okay, so an open tray impression is classified as what? Is it abutment level impression, implant level impression, or the above, or none of the above? Right. So you're supposed to know this. This is very important when if you are going to be studying for the this exam. Okay, make sure you know the closed tray impression and the open tray impression techniques. Okay, so our answer is B. Okay, open tray impression is classified as an implant level impression. Okay, all right. So looking at closed tray versus open tray, so you can either use closed tray or open tray. All right. A closed tray is usually efficient and cleaner and more comfortable for the dentist. And the open tray may improve accuracy when you're taking impression of multiple implants. All right. And open tray works better when there is several severely angled implants. So if you put an implant in certain angles, for example, you place some the zygomatic implants. Most of those are going to be angled. So the best impression that you're going to take is going to be open tray impression. All right. So whenever you have, or you place implants and some of them are in different angles, so the best way to take this impression is the open tray impression. So you're supposed to know the differences between open tray versus closed tray impressions. Okay, for implants. So question number three: a dentist is placing two implants to replace missing teeth 28 and 29. So these are the lower right premolars. How far apart should she place the two implants? A, 1.5, B, 2.3 millimeters, C, 0.5 millimeters, or D, 3 millimeters. So at least 3 millimeters, okay, apart. So if you're putting two implants in an dental site, those two implants have to be 3 millimeters apart. Okay, so answer is D. All right. So make sure you understand that if you have two implants, all right, if you have two dental implants that you're placing, All right. And so you have to make sure that the distance between them, this distance, is 3 millimeters. Okay, keep that in mind. Question number 4. At the implant interface, the layer that is found between the complex of titanium and the calcium phosphate and mineralized bone is likely to contain what? So you have to know the when the implant is osseointegrated, you're supposed to know what kind of layers are formed. Okay, which layer is close to the implant, which layer is far from the implant, or which layer is close to the bone. All right. So our answer here, so the it is osteopontin is the layer which is found between the complex titanium and the calcium phosphate and mineralized bone. Okay, so let's look at the review of the layers. Okay, so make sure you memorize this slide. Okay, so the layers from implant surface to alveolar bone. Okay, so the first layer from the implant. So on the implant surface, you have the titanium oxide layer right on the implant surface. Okay, and then you have the titanium phosphate layer and the calcium phosphate. All right, so the first layer on the implant is titanium dioxide. The second layer after that, you have the titanium phosphate and calcium phosphate. The third layer, okay, is a non-collagenous bone matrix or protein, which can contain osteopontin or bone sialoproteins. Okay, and the last layer, which is this layer, which is close to the alveolar bone, is the osteoid and mineralized bone. Okay, so make sure this slide is very important. Make sure you memorize this slide. Okay. All right, so moving on. Question number 5. Which property of titanium allows dental implants not to interfere with MRI procedure or airport screening? A. Tensile strength. B. Magnetic. Are they implants magnetic? C. Their ductility. Or D. Non-ferromagnetism. So non-ferromagnetism is the one which allows people with implants to have MRI or go to the airport without ringing bells. Okay, and for sure, you know that if you're going to place implants, the patient, the first time, they're going to ask you that question because they are worried about that. So you have to explain. Okay. So implants are non-ferromagnetic. So our answer here is D. Stroman. So Stroman implants. So the Stroman SLA active implant has been engineered to have what kind of surface? Okay. So these Stroman active implants, they are engineered to have hydrophilic surface. Okay, so I'll answer A. All right. So some of the features of the Stroman SLA active, it is its topography and hydrophilicity and the chemical activity. Okay, and so looking at the features more in detail, so it is active because it's chemically active to initiate the osseointegration process sooner after placement implant. And what does chemically active mean? It means it has an attractive surface, so it attracts um, the blood and the nutrients. Okay, um, and the chemical activity attracts blood and proteins. Okay, to micropores of the implant surface, and this helps to initiate the osseointegration process. Okay, and therefore The earlier the implant is osseointegrated, it increases stability of the implant during the early stages of osseointegration. Okay, so make sure you know some of the features of some implants. Okay, question number 7: what is the dimension of biological width in healthy tooth? Okay, A, 2 millimeters, B, 1 millimeter, C, 1.5 millimeter, or D, 4 millimeters. You have to know the width of biological uh, dimensions. Okay, so you have to know that. So our answer is going to be A, all right, which is 2 millimeters. Okay, now the biological width, you have to know that biological width around the natural teeth, the epithelial attachment and the connective tissues form the physiological attachment apparatus around the teeth. Okay, both epithelial and connective tissues, they form the physiological attachment around the teeth. And there is a minimum of 2 millimeters, that's the biological width, of tissue thickness separating the bone from the oral environment. All right. And the dimension comprising the tissue width of the epithelial and connective attachment is called the biological width, and the subgingival plaque usually can induce inflammatory connective tissue infiltrates, which can span zero point 0.9 millimeters in the biological width. So that leaves about 1 millimeter of healthy connective tissue above the bony crest. Okay, so when you place an implant, you're supposed to understand these dynamics. Okay, and the composition of the connective tissue associated with implants shows differences from the mucosa around teeth. So you're supposed to know what are the differences between the connective tissue surrounding natural teeth and the connective tissue surrounding implants. Okay, make sure you know that. So there is an increase in collagen fibers, a decrease in fibroblast, and a decrease in residual tissues. Okay, so make sure you know that. Okay, one of the clinical manifestations of the differences in the peri-implant mucosa is that the clinician may find less resistance to perio probing. So when you're probing natural teeth or natural sulcus, there's some resistance there. Okay, and that's because of the arrangement of the connective tissue fibers. However, around implants, usually they have deep probing depths. Okay, because of the irregularities in connective tissue attachments, so there's less resistance in probing. Okay, so you have to review the difference between connective tissue patterns of around the natural teeth and those around the implants. All right. Question number 8: what is platform switching? Okay, you cannot be studying implant without knowing what platform switching is. So platform switching: A, is it mismatching a large implant with a narrower abutment, or is it mismatching a smaller implant with a wider abutment, or placing the implant with its platform inverted, or none of the above? Right? So make sure you know. Okay, our answer here is A. And so the purpose of the platform switching, okay, see, so platform switching is mismatching of a large implant with a narrower implant, okay, of with a narrower abutment, sorry. And usually this does is it medializes, it moves the interface of the implant medially. Okay, and minimizes the vertical repositioning of the crest of bone and subsequent soft tissue attachment to implant. So, if you have an implant, here, okay, let's say you have an implant and you're going to put an abutment. So, if your implant was a 4 millimeter implant, okay, so then you're going to mismatch the abutment, okay, so you're going to put a narrow abutment. So for example, your abutment is this narrow, okay, so you can see that there's space here. That's what it means. It has moved, it has medialized the interface, okay, the interface, this space that I pointed at, that's the interface between the abutment and implant. And so when the bone starts to form, and bone is going to form here and form here, okay, and cover the implant. Therefore, it's protecting the implant and it's also going to have less bone loss. Okay, so it's advantageous in protecting the implant and preventing excessive bone loss. All right. So make sure you know advantages of platform switching. Question number 9. What's the minimum required bone on the facial and lingual of the dental implant? So make sure you know. So is it A, 2 millimeters, B, 1.5 millimeter, C, 3 millimeters, or D, 1 millimeter? Okay. So our answer is D. Okay. So the minimum bone required on the facial and the lingual of a dental implant is supposed to be 1 on the lingual and 1 on the facial. That's the minimum. Make sure you know that. And question number 10, using the principles of what we learned in question number 9, and so we can answer this question: what is the minimum interdental distance, meaning that tooth to tooth or mesiodistal length of edentulous space for a 3.5 millimeter implant? Okay, so for a 3.5 millimeter implant, how much space do you need? How much of edentulous space do you need? All right, for you to put a 3.5 millimeter implant? Is it A, 6.5 to 7 millimeters, or B, 8 to 9 millimeters, C, 5 to 6 millimeters, or D, 10 to 12 millimeters? So if you said A, you are correct. And the reason for this is that if you have a tooth, okay, if you have a tooth here, that's your CJ, and you have another tooth, let's say that's is a premolar. Let's say this is number 30, okay, and this is number 28, and we are replacing 29, right? So how much of this space should you have to place a 3.5 millimeter implant, right? So remember the principles is, so the 3.5 millimeter implant, so let's say this is an implant, and this implant, the width of the implant is 3.5 millimeters, right? And we know this implant is supposed to be at least 1.5 millimeters from the natural tooth. Okay, so this distance here, we know it's supposed to be at least 1.5 millimeters. And this distance here from the implant to the tooth is supposed to be 1.5 millimeters. Okay. So now, so how much distance do you need at least? So you have the 3.5 plus the 1.5 plus the 1.5, right? So how much is that? So this is going to give you at least 6.5 millimeters, right? So you need at least 6.5 or 7 millimeters to put this size of an implant. You need that much of space, edentulous site. Okay, make sure you know how to calculate these spaces. How much space you need to place an implant. Okay, and these days there's even smaller implants, so you're supposed to know how to calculate what's the adequate uh, space for the specific implant that you want to place. Okay, all right. So coming up next will be the dental implantology. Make sure you subscribe and click the bell so you can receive notifications on the new videos. And for those of you who have been doing the review exams, if you have any questions, you can just email me on for explanations. Okay. All right. Good luck.